Hi, good evening, everyone. Can you hear me?
Hi, good evening. We can hear you, Shishi. How are you?
Good, thank you. So, welcome to another episode of today's webinar, and we're going to be talking about autism, a topic that is actually very dear to my heart because I think we decided to talk about this topic because a lot of people that attend these webinars really wanted to have a few questions addressed. And I think we're really, really lucky today because we've got a very distinguished speaker that will be speaking to us today about autism. And I'm really excited about introducing him because the first time I was looking for someone to actually talk about this topic, what was really important to me was to find someone that's got vast knowledge about autism and I can talk about it in different ways so that people feel really comfortable when it comes to questions that are really burning. So just a bit of recap again, how this works is if you have any burning questions, just put it to the chat to Anomal Health and we'll try and get our speaker to try and address your question. And we hope that you leave today feeling much more informed than you are already. So without talking too much, I'm going to introduce this amazing speaker who we've been really lucky today that will be speaking to us. So he trained in a lot of regional centers and hospitals in the UK. And so he's worked not just across in the UK, but also in the UAE and other parts of the world. He worked as a lead pediatric neurologist. And neurology means like a nerve doctor that looks at things about development, how the brain develops and different things. In the university hospitals at Leicester and the NHS for about 3 years. He was actually the lead clinician for complex epilepsies, vagal nerve stimulation services, and ketogenic diet services in Leicester. He then went on to found what's called the Neuropedia Children's Neurosciences Center in 2018. And then subsequently, he moved to Dubai and started the first ever pediatric focused orthotic and prosthetic service that is known as Extremity. He's an avid writer. He's authored over 40 peer-reviewed journals and public health publications. He's also recently authored a book in pediatrics. So he really knows about how children work and how they develop. He's also an associate professor of pediatric neurology at the prestigious Mohammed bin Rashid University in Dubai. He has lectured students not just in Dubai and in the UAE, but also in England. And it's well known when it comes to things to do with children and how they develop, and obviously going all the way to autism, which is what he's going to be talking to us about today. Despite his wealth of knowledge, he's also giving back by being an examiner at the Royal College of Pediatrics and Child Health. And I'd like to welcome today Dr. Arif Khan, who will be speaking to us about autism. Welcome, Dr. Khan.
Hi, Dr. Chihi. Thank you very much for this invite. And it's a pleasure speaking to a different audience. I tend to speak to people in the UK or in UAE, mainly doctors, sometimes parents in schools, but this is kind of a very unique new audience that I'm seeing. But I'm excited to move ahead with the session.
Honestly, I'm really excited because we're in London and then some of my team are in the US. People have logged in from different places. I can see people that have logged in, not just from the UK, from Canada, from Nigeria, and from different places. And I think we're really obviously lucky to have you because it must be it's 9 p.m. in Dubai, isn't it?
It is. That's right.
Hopefully, we wouldn't keep you too long so they can get some rest and do the great job that you do every day. Thank you so much for coming. I was just going to dig in by a few questions that we've received. And I think for a lot of people, especially parents, when you give birth to a child, there's always this worry about, is my child developing properly? Is there something I'm missing? We're constantly checking, making sure we're not missing out to anything. And I think the best way to start the session is if you could describe to us what autism means. I know it's such a broad spectrum, but is there what we should be looking out for? What is the definition of autism?
Yeah. Autism is a neurodevelopmental problem. So a child is born with a potential or likelihood to have autism at a certain age. So it is not something that a child acquires. The child already has that innate genetic makeup that makes him or her prone to have the diagnosis of autism at a certain age. So by definition, it's a neurodevelopmental disorder that has three main characteristics. Number one is deficits or difficulties in communication. And those communications could be verbal or nonverbal. That's one. Two, deficiencies or deficits in social skills and interaction. That's two. And three is repetitive behavior, mannerisms or behaviors that somehow helps the child regulate their emotions, but they keep doing a certain mannerism all the time. When they're anxious, they're happy, or they're sad. So these are the three components that form the core of, or they call the core symptoms of autistic spectrum disorder. It's not called autism anymore. It is autistic spectrum disorder, because now we know it's not one single condition, but rather a group of conditions that have a different heterogeneous mix that are put together.
Thank you so much. I think it's good that you said it's a spectrum. So it's not like it's one thing that describes it. And therefore, I guess a lot of people always say that each person in the world has a bit of a spectrum somehow.
Yeah.
I mean, we say that a lot in the UK. I don't know
What I say is that no two kids with autism are alike. So every child with autism has its individual challenges and strengths. So you can, I have parents coming to me and saying, oh, I think my child might have autism because I've seen my friend's child who has the same thing with a diagnosis. It doesn't work like that. And that's the first myth that I would like to bust before we move ahead. Yeah.
So I was going to say this, like, because you talked about the fact that it's actually a spectrum and not one of diagnosis. I was going to ask you a question, which is, people use words like, which I think a lot of people are confused about. People use words like, this person's an autistic person. Somebody else will say the person's on the spectrum. And then why some people will say the person is a person with autism. Is there a way of like differentiating, or are they all intertwined?
You know what? If you use these three terminologies on three different families, someone will get offended. So there is no right or wrong about things. But in medical terms, when I communicate a diagnosis to my colleague, I say this child has autism spectrum disorder. That's the medical terminology. Now, in day-to-day language and discussing about it, we do say, okay, the child is autistic. We shouldn't use that, but as a theme, as something that we've been using for a long time, we stick with that. So it's usually a child, we don't say suffering from, first of all. We say a child with autism spectrum disorder. Yeah.
Okay, makes sense. So you talked about the things that it could affect the verbal, it could affect communication, and obviously other stuff. Is there any other, like, is there another way that it can affect a child or even an adult? Because again, I've seen people that have said I've been diagnosed as an adult, for example, of autistic spectrum disorder. What are the ways it actually affects people that it's, I guess for people, everyone wants to like find out on time so they get the right help on time.
So two aspects to this, Chichi. One is when I say it's a spectrum, let me give you the two ends of spectrum. Okay. So you have a child who doesn't have any verbal strength. They don't speak a single word. They're fully dependent on their parents. They are 18-year-olds. They're not toilet trained. They are not independent, and they have to be looked after continuously. That's one side of autism. Whereas on the other side, you have, I have a friend who is a commercial airline pilot, who is independent, has 2 kids and a wife, and is flying a plane and carrying 300 people with him. So these are the two spectrums. So that's why it's such a wide spectrum that you cannot generalize it or have a generic definition even. When we talk about older people being diagnosed later, these are usually individuals who do not have strong core symptoms. So they were verbal, they were going to a mainstream school, they were a little bit kind of weird with regards to the social interaction, but they carried on, they managed. And then as they grew older, they got married or were in relationship. That's when the conflict of their emotions started showing up. And when they went to a psychiatrist or a psychologist, that's when the diagnosis of autism was made. And many of them are high functioning. These are individuals who are high functioning, who are really clever in what they do, have some kind of savant skill sometimes where, there are people who can read the entire dictionary and remember it. And there are people who, whole telephone directory they can memorize. So these are savant skill. Obviously, savant skills are not something that will help you with your social life, but many people have it. And that amazes us when we see them. But most of the adult ones that are diagnosed later in life are the ones who have escaped the diagnosis early on, or they are in their mid 40s or early 50s, because in the 70s and early 80s, autism was never diagnosed. So this is what it is at the moment. Yeah.
What do you think was the reason why there weren't just a lot of diagnoses in the 70s and 80s, even though this existed, right?
Yeah.
I think that's always the question. Like, we wake up one day, we have this new thing, and then it's like everyone's talking about it. I'm not sure.
I know the answer to that question, and I don't know. So let me just explain to you what I mean by
that. I know, and I don't do. That's a good.
Yeah. So in 1970, that was a little before I was born, the prevalence of autism was 1 in 10,000. 1 in 10,000. Today in US, it's 1 in 36.
Okay, so
you can imagine the proportion by which the prevalence has increased. Now, why was that? Now, if you look at the prevalence of a diagnosis called mental retardation in 1970s as compared to now, it has come down. So many of these kids were bracketed under mental retardation, intellectually disabled, many other diagnoses early on, because autism was not very prevalent. And it was in 1988 when the movie Rain Man came in.
oh,
That's when
Raymond.
that's when it became really famous as a diagnosis, and people started noticing it and understanding individuals with this problem. So I think majority of the reason why the prevalence has shot up so high is that we are bracketing them better. We are more aware of autism now. Even GPs and pediatricians can diagnose them. So we are more aware, we're diagnosing better. But yes, for some reason, there is an actual increase in prevalence as well. That could be environmental, it could be lifestyle, it could be genetic conversions or evolution over the years. We don't know. But what we know for sure is majority is because of better recognition and better definition of the condition.
Okay. I think what people also wonder, right, like when they've got this, their child or as an adult, they get a diagnosis of autistic spectrum disorder is that what causes it, right? Is there something we could do to avoid it? Is there something we didn't do? Or is there, like, it's always like a battle, especially for families.
Yeah.
And there's a lot of like blame culture, or maybe the pregnancy took too long, or maybe you didn't eat the right food, or, I'm not like, it's just, it would be nice to cast an eye on what you think.
So once we give the diagnosis to parents, the first question they ask after that is why?
Why exactly?
Why did my child have it? And first of all, what I do is why not? So I tell them what they shouldn't think about. So when always parents blame themselves and their pregnancy and what they have ate or drank during pregnancy, or they have done during their pregnancy or after birth, or how they have managed the child in the first year of the child's life, none of that matters. That's not the reason why your child has autism. Your child was programmed to have autism even before he was born. Because what we know is 80% of the underlying etiology or cause of autism is genetic. So genetic doesn't mean my father or mother has to have it. Genetic could be that some of the genes in my body have undergone error while they were being passed from my parents to me. It's called de novo in medical terms. And that's where 80% of conditions of autism happens. 20% is environmental. And how we know this, there's a lot of concordant twin studies that were carried out. So twins who were identical twins who have the same genetic makeup. So if one twin has autism, there's an 80% chance that your twin would have autism as well, as opposed to discordant twins where it's less than 20%. So that's why we know that genes have a major role to play. And it is not a single gene. It's like polygenic. It's like hypertension. It's not one single gene, but a collection of different genes that can cause autism in a child.
Okay. So I think the $1 million question, which everyone's waiting, like all the parents want to hear, is that if you remember in 1990, right, Andrew Wakefield came up and said, like, if you give mumps, measles, and rubella vaccine together, it causes autism, right? And I think following that, obviously, there's been a lot of like research. People have withdrawn his research and banned him from practicing medicine in the UK, which is like a very big like thing, right? But I think that has scarred a lot of people, either positively or negatively, I don't know. But I think that even though his theory has been disregarded over the past decade, right, it continues to be a problem. I think when we did this topic, a lot of people were sent that as a question. Can I give my child MMR as a combination? And even you're shocked doctors, like I have friends that are like doctors, consultants, and they're saying, listen, I'll give the vaccine separately. And I just wanted to say to you, like, I think it's good that we've got you here because this is like the beam of what you do. Yeah. What do you think about this whole thing?
Can I share a screen, Chichi, if that's okay?
I think you can actually.
Okay, let me just quickly have a look if I can do it. I think
you can, and we can always pin it for you to share the screen.
Share.
Because you've got sharing rights to share a screen. Because you're a co-host also.
Push on screen, computer.
Can you see it? So while we're trying to do that, just remember that if you have questions, please send it put it in the chat box, and then we'll try and address your questions at the right time. Okay. We're not allowing people to speak, but we just want the questions type out. Just type your questions in and we can just share your questions with just can.
Can you see my screen?
Not yet. Try again. Or do you want to send it to me to share for you?
No, it's a different program. It's called Prezi. So let me just
And you
see
see
if
you're
I can.
sharing on your screen?
You can't see it, isn't it?
No, we can't.
1 second. I'll just try and get back to
So if, for
Zoom.
people that are just joining, we've described the fact that autism is a spectrum. So there's someone that is not functioning very well, someone that is really high functioning. And we're just talking about the relevance of the MMR vaccine with the diagnosis. And we're just trying to...
Okay, let's skip this one. Maybe next time we can, I'll
Okay,
just
yeah,
talk about it.
they
Yeah.
sent it to me ahead of time.
Yes.
Perfect.
I'll just get back. Yeah. So
So
your
we're talking
question
about Andrew Wake. We're talking about Andrew Wakefield's amazing research, right? That the UK has gone crazy about and banned him from practicing medicine ever, because according to them, I'm not sure. Like, I've not been in that situation, so I'm not sure how I will deal with this, you know? So it'll be nice.
So Andrew Wakefield, I had the privilege, or not so much, a chance to meet him in the 2000s. This was not 1990, it was 1998 to be precise.
Okay.
Yeah. So he, along with some colleagues, wrote a paper suggesting that with his research, he's found that MMR is one of the major factor or cause behind autism, MMR vaccination. Now, obviously, after this was raised, and it was not published in any small journal, it was Lancet that it was published in. And it was very widespreadly, it was read by everyone across the globe. And following this, we saw an outburst of measles across Wales and even in Germany in some areas. And there were a few deaths even in children because parents stopped giving their kids vaccination. Following that, in the next about 20 years or so, from 1998 to 2008, and then up to 2018, there have been at least close to 250 papers that have been published, with in each paper like 15, 20,000, up to 100,000 children enrolled to confirm that there is no relationship between MMR and autism. But his paper was completely discredited, as you said, and simply because it was based on people's memories. It was based on very poor statistical analysis and very poor interpretation. And following that, a number of papers came out which completely declined this theory. But it's a human tendency to stick on to negatives rather than positives. And we as humans hold on to things like out of the blue hypothesis rather than the common hypothesis that we come across. So there is no relationship between MMR and autism as such. And even today, like in the UAE, for example, MMR is the national program and every child gets it. But if you look at US, for example, or even in UAE, for example, there are 1.8% of parents still believe that MMR causes autism directly. And up to 25% of parents tend not to vaccinate their child with MMR considering this. So it is still there. And there are big proponents of this theory still. Like there's a movie called Vaxxed, VAXXED, which was shot in New Zealand, where they propagate this theory that vaccination causes this, and there are some commercial entities behind this who are pushing for it and all that. So this kind of witch hunt, people pushing for this theory all the time always will remain. But we as doctors, what we're trying to do is trying to make sure that every child who is born in any part of the country does get MMR within the first 2 years. So MMR and vaccination has no relationship. That's what I would like to.
Thank you so much. So, I think it's a good thing to address it, because I've had people actually recently, someone saying to me, I'm going to give the measles there. I'm going to split the vaccine into different things. Like, it's still the same vaccine. It makes no difference, right? And I think it was good for people to realize that the risk of not having your child vaccinated outweighs, and I know, obviously, but a lot of people just have to come to terms that this was...
See, the only reason we don't have polio today is because of vaccination. The only reason we don't have, at least in Dubai and UK, for example, meningitis C, meningitis B, the life-threatening CNS infections is just because there have been excellent vaccines that have come out. And these are numbers that don't lie. They're out there for everybody to look at. So vaccination is there for a reason, and implicating vaccination towards a condition that is genetic, it doesn't make any sense.
Okay, thank you so much. So I was going to ask another question, which is, I know that as we said, autism is a spectrum, but also there are other conditions that can sometimes be associated with it or actually mimic the spectrum, but it's completely different. I don't know, is there other things people should be watching out for that? So because a lot of people just say, oh, I think my child is autistic, and it's other stuff is also going on at the same time.
Yeah. So differential diagnosis and mimics, yes. So when a child comes to me, usually they come between 18 months to 3 years. That's when parents bring their kids. And, there are some red flags that are raised up, like my child doesn't look into my eyes, doesn't respond to the name. They don't have any single word. They do not understand instructions, have certain mannerisms, no social attachment, no emotional attachment, and on all that. These are very common symptoms. Some parents also say my child regressed. When my child was 1 year, maybe 14 months, he could speak few words and then he suddenly lost his language. So this is the common presentation. Our job as doctors or neurologists or psychologists or psychiatrists is to make sure that the initial core symptoms are present. We run these symptoms against a standardized criteria, which is called ADOS or CARS. There are many assessment tools, and we give a clinical diagnosis of autism. Now, when we give a clinical diagnosis of autism, as doctors, we have to make sure this is nothing else. So, for example, you can have what is known as epileptic aphasia, where you have very severe epilepsy, which is not visible, but once you do an EEG, you might pick it up. So make sure it's not that's not the reason for the child's lack of language. Then you had previously conditions like Landau-Kleffner syndrome, where you have absolutely normal language until 3 years, 4 years, and then suddenly you lose your language. You forget how to speak and you stop speaking. And they may or may not have seizures as well. So this happens later in life, as opposed to autism regression, which happens at 12 months or 18 months. So we as doctors should be able to differentiate that. We look at the thyroid functions because sometimes that can lead to communication difficulties. So we should know what to look out for and to rule out before we classify a child has a particular type of autistic spectrum disorder pattern.
So do you think, Arif, that early diagnosis is really important? Like, do you think that if the kids were diagnosed very early, does it make a difference with their management long term?
That's the only thing that makes a difference. So early diagnosis is important because early intervention is important.
Okay.
And if you start intervening between 18 months and 4 years of age, you have a much better chance of achieving a better outcome than intervening later in life.
And then I think that brings us to what interventions. I know it's a massive spectrum, right? But are there like domains of interventions if, like, I don't know, what, like, are there like domains of interventions that need to be started early? Or I guess they're child to child, I guess, more.
So a lot of people have made a lot of money selling treatment for autism. So that's a topic that I talk about many a times. I have a different presentation on that. To put it in simple words, there are more than 90 different treatments that have come up in the last 3 decades, from camel's milk to people selling bleach for parents, for kids to drink, to things which you can't even imagine. Omega, okay, there is some reason to give that. Ketogenic diet has come up. There are so many reasons. Stem cell therapies to hyperbaric oxygen. It doesn't end. But none of these have evidence backing them up. None of these. So when parents come to me and say they're seeking, because parents are frustrated, they are quite at the end of their tethers, they want to do something for the child, they would go to any extent to do what they want. And if you Google it, you will probably have a list of 20 things to do as interventions, and they will probably go one by one with it. And eventually, after 2 or 3 years, come back and say, we've tried everything, nothing has worked. My advice is not to push yourself behind it, because if it was true and it was something that was evidence-backed, major hospitals like Mayo Clinic, Great Ormond Street Hospital in London, they would be advocating it because it's out there. If we know that it works, why are we not using it? So at this point of time, once a diagnosis is made, a child needs a very good social environment, which could be a nursery, which could be a special school, which could be a mainstream school, depending upon the child's need. And adding to that, they need behavioral input. So whether you give them ABA therapy or some cognitive therapy, any kind of behavioral input, along with speech and language therapy and occupational therapy in different proportions. It depends on the child. So kid who is 3 years and verbal probably doesn't need so much of speech therapy, may require basically behavioral therapy for their social skills, a little bit of occupational therapy for their sensory needs. And another child who has significant verbal deficits might need speech therapy along with behavioral therapy to start with. So that varies overall.
I think what's really important that you said I was going to highlight is the fact that you need to be treated by the right person. And I think that's why we're doing this with you, because you're like a specialist, like a super specialist in this topic. And I think people have to be really careful about just meeting mediocre people that don't have no experience what they're talking about. And I think it's really important to stress at this point that not every pediatrician is qualified to look after autism. And I think that's why we do this, because I like people to listen to experts who have years of experience doing this, who have like our authorities like you are, not just in the UAE, but also in the UK and everywhere, speaking about what you need to be doing. Like, and it's good to, and I like what you talked about, places like the Mayo Clinic, the Great Ormond Street, they're not recommending any of these treatments and people are doing it and just like literally burning money for no reason, you know? And I know the world is taking advantage of people when people are distressed. And I think the whole idea is that we get the best help from the best people that exist. And honestly, I'm really grateful you're here and speaking to us about this topic.
And Chichi, burning money and hope.
That's is true. Yeah. And hope is true. I think the hope is actually the really bad thing, because it's almost like taking advantage of someone that is on the floor and you're stepping on them, telling them all these things, and they're just devastated.
Yeah.
I think one thing else I like when I was thinking about this topic was I felt like things like family education, right, should be a major factor. And I just wanted you to cast a little bit of light about the family as a whole, as a system, as a unit, when people face this at the moment.
So the first thing a parent, whether it's mother or father or both of them, do once they get a diagnosis is they go onto Google and they open up autism and they go onto the wrong websites to look at what autism is. So we at Neuropedia, we've developed some kind of leaflets for them to go back and look at Autism Speaks, autism.org, which are accredited websites with the right information and information that is updated regularly. So we ask them to go to Google and read these particular websites and enlighten themselves about what to expect. Beyond that, we have started something called as parental counseling sessions, or we have a parent counselor within Neuropedia who, once the diagnosis is made, offers parents to sit down with them and give them some kind of an idea. And this is a lady who had a child with a very severe epilepsy syndrome, and the child is still significantly disabled. And she knows what she's gone through, and now she has the strength to support others, and she's come forward and she's developed this counseling program for parents, and she sits with them, takes sessions, does workshops, gets them out in a coffee shop, meeting 10 other parents who've had a new diagnosis, and trying to share emotions as such and what they've gone through. So that helps. In NHS, when I was working in the UK, that was pretty difficult. There were good organizations voluntarily where parents could go and talk to them, but within NHS we didn't have the support system to individually care for these families as such. But in Dubai, thankfully, within Neuropedia at least, we have made sure that there is something out there that parents can fall back on.
Thank you. So, and I think the work you're doing in Neuropedia is amazing. Like, you know, I looked at it and I was like, this is like top notch, right? You're able to help people. And I think I was going to say that obviously this is happening because you also work with Bougel Medical Center, which is like world renowned for like anything medical, right? Yeah. And I think it's also really great that as part of this collaboration that we're doing, we're able to offer patients maybe on the call, you know, someone that wants to get more information or wants to speak to one of the doctors, and we can offer them a virtual consultation for free, right? So they then decide to come on to, or even then start their treatment, not being present in Dubai, because some people have a few restrictions to get into Dubai at the moment. So I think it's like amazing work from you, from Bougel Medical Center. Like, I can't be more grateful.
Thank you.
And now there are 1 million questions, by the way. So I think I'm going to stop ranting. I was going to ask one thing before we go. I know we talked about associated factors. I know one of your big point that you stress on is comorbidities also. And I was going to say, like, even if for like just share a little bit of that with us, what are the stuff people expect in the long run? I think that's very difficult because a lot of people go into this journey not being completely sure what to expect.
So when the core symptoms of autism are looked at and when the child receives a diagnosis of autism, yes, the therapy would start and parental counseling would start. But throughout their journey of the first 15, 20 years, there might be conditions that might come up because that particular child is prone to have those conditions. For example, epilepsy. Now, epilepsy is present in about 30 to 35% of children with autism. Either an abnormal EEG or clinical seizures can be demonstrated, but we have to watch out for that. 2, severe anxieties. Children with autism, about 80% of them have anxieties. Now, anxieties are important for every human being because if we were not anxious, we won't be reaching the airport on time. So that is important for us. Yeah. So an element of anxiety is a normal characteristic that all of us have. But when it goes beyond a certain level, becomes irrational, that's where it starts affecting your social life. And once a child with autism is anxious, they will demonstrate that by unsocial behavior, screaming episodes, self-harming, and all that. So we have to watch out for that and treat anxiety if that were to happen. ADHD, parents don't understand this sometimes. ADHD can coexist with autism, and that has to be looked out for and treated or started on medication appropriately if needed. Sleep, 80% of children with autism have problem with sleep. Either they have an initiation problem where they can't go to sleep, or they have maintenance problem where they go to sleep, but they keep waking up a number of times. That have to be looked into and examined properly. Genetic underlying problems, that has to be looked into, make sure the child doesn't have any specific syndromes that you're missing. Constipation, children with autism have problems with feeding, of course, because they have sensory needs and all that. They don't like certain textures in their mouth, but many of them have constipation, and that has to be managed. So these are comorbidities that you should look out for in children when they already have a diagnosis of autism.
Okay, thank you so much. I think I'm going to take a break from asking like the questions that we had for you, and if you don't mind, and we're going to go on to the question the audience have. They have a lot of questions. I'm sorry, Arif, there are loads of questions.
That's all right.
It just shows like how interesting this has been. And I think it's been so educative for a lot of people. And as the comments, everyone's like, thank you so much. Thank you so much. So the first question is, he says, can tantrum be part of autistic spectrum disorder? I think you touched a bit on that already.
Absolutely. For you, it's a tantrum. I mean, this is a parent asking the question. Then for a parent, it looks like a tantrum, but the child knows why they're doing that behavior. There's always an antecedent and a reason why our behavior is executed. And once we know that antecedent, we can change the consequence of the behavior. We call this as an ABC technique, where A is antecedent, B is behavior, and C is consequence. So what you're seeing as a tantrum is a consequence. And we have to find out what was the antecedent, what caused this, and we change that to change the behavior. In children with autism, it's usually anxiety that brings about that behavior. It's change, because they don't like changes very much, unexpected, sudden announcements or change in routine. If that happens, they would throw out that behavior. So those are not tantrums as you would see in a neurotypical child, but they always have a reason behind it.
Okay, thank you so much. And the next question says, hi, my name is Ify. One of my twin son is on the spectrum, diagnosed with level 1. My question is, will GAPS diet help? I think maybe cast a little bit on what GAPS diet is for people that don't know what GAPS diet is, and then see if it's going to help. That's the question.
Over the years, as I said, even ketogenic diet and many other diets have come into picture. We had like casein-free and gluten-free diet, as you would know, in autism. Organic foods, they're a part of the diet as well. Then fermented food with every meal, and things like that. It's a combination, a cocktail, and all that. Currently, there is no evidence, medical evidence, to say that it works. But if it's not harmful, I always tell parents, go ahead and try it. Even with casein-free, gluten-free diet, I used to say, just try it, because there's no harm. There are many sportsmen who, with casein and gluten-free diet, have actually enhanced their performance. Novak Djokovic, our tennis player, being one of them. Yeah, he just changed his overall performance in mid 2000s, I think, as soon as he debuted. So I tell parents, go try it. It will not change your child's core symptoms, but it'll make your child more healthier, feel better, and that might reduce his excessive unsocial behavior. And if it doesn't work in 3 months, remember to stop it. Because if you take casein and gluten off your diet, imagine what your life is going to be. Your quality of life or your eating social life will be very poor. So I tell them to remember to take it off if it doesn't work.
Thank you so much. I hope that addressed that question. Somebody else from Canada says, what's the best way to assist an autistic child to adapt socially? I think we touched a bit on that already.
Yeah, we did. When you make an initial assessment with ADOS, for example, which is Autism Diagnostic Observation Schedule, the gold standard for diagnosing. And once you have...
Sorry, I think there's someone. Please, can we all mute ourselves, if you don't mind? Because, sorry, apologies about that. Yeah.
No worries.
Yeah, apologies.
So, what were we talking about?
We're talking about how to help a child adopt socially. Yes,
yeah.
Adapt socially. Sorry.
So once the ADOS diagnosis is made and confirmed, then the child has to go through initial assessments with a a BCBA, a behavioral consultant, a speech therapist, an occupational therapist, because those are experts in their own area. And the behavioral consultant tries to find out what causes the behavior to change, what are the triggers, what are the antecedents, when does a child behave at his or her best, how he responds to his environment, whether it is school or his family, parents. And they study all that to then find out what's the best way to reinforce a better behavior in the child. And then they will advise you with that.
So the next question is, thank you, Dr. Kanan Anomo. Thank you so much. Loving this conversation. How is it genetically influenced? I think you touched on that already about the twins and how one twin and the other one. And then what are the chances of a child getting it? I mean, considering one can have multiple kids and only one of those is diagnosed with ASD. So I guess they're saying if they've got multiple kids and one is already diagnosed, what's the chance of another child getting it when they're not twins?
It's very small. So when it's happened to me a number of times, parents have, say, for the first child having a diagnosis of autism, there is no family history of that. And the child doesn't have any dysmorphic features. There is no specific syndrome, just purely idiopathic autism. And parents say, do we go ahead with the second pregnancy? Of course they should, because this is not a single gene disorder. Usually this is a polygenic disorder or multiple genes or multifactorial. And usually these genes are not inherited. They are de novo or with an error. So I would just say, go ahead and, get your pregnancy through without any problem.
Thank you so much. The next question is, thank you for this lecture. Thank you. It's really amazing, honestly. Please, can you go over the symptoms that mimic autism?
Oh, wow. That's a session in its own right, actually. Yeah, there are about 30 to 40 different symptoms or signs that we look for. A child less than 18 months of age obviously will have lack of speech. Most of them have lack of speech. They have lack of reciprocal interaction, poor eye contact, response to name is minimal or zero. They have certain mannerisms or repetitive behaviors when they're excited or they're angry. They don't show any emotional quotient. They don't show emotions when their parents, say, for example, pretend to cry or get hurt. They don't point at objects. There is no proto-declarative pointing. Like if I want to show you something, I will not point. If I have autism, I will pull your hand and take you there. There is no joint attention. So if I say, look, I can see something there, the child with autism would not turn and look at you. So that understanding is not there. And there are many more. These are just the core basic ones that we come across.
And they look like, and it could be something else, isn't it?
Absolutely. So it has to be, the assessment or the diagnosis has to be given by experts who are trained to do that. And they could either be a pediatric neurologist, a child psychologist, a psychiatrist, or any of the other allied specialties if they have completed their courses like ADOS to do the diagnosis.
So I think what's important, that what we're getting out from this is that it has to be diagnosed by the right person with the right expertise, right? And you guys do that in your center. You're known for this, and I think that's what people need to be thinking about, is going to the best place for themselves, not just by any random person. Because once a child is labeled, they're labeled, and then if you don't get help, as we talked about on time, then the child's development can be severely impeded, isn't it? What
upsets me most is when parents come to me and say, okay, I had been to my pediatrician, my child just walked into the room and the pediatrician said, I think your child has autism or he doesn't have autism, by looking at a child. See, I've been doing this for 20 years, and even I know when the child walks in that yes, there are some features there, but I never ever give a diagnosis based on my assumption or guess. I say to parents that it doesn't matter what I think. What matters is what I can prove to you. And unless you go through that assessment tool and complete the proper assessment, I would not be telling you what I'm thinking or what I'm guessing at this point of time. So, that is important, not to make guesses with a lifelong diagnosis like autism.
Child, yes, exactly. Because it defines the child's life forever, isn't it? Yeah. And it's about getting it right the first time, and then you get the right help for the patients. We see a lot of getting it right the first time in orthopedics, right? So it's like a tag I have to use, like get it right. So the next question, I'm sorry, but there's so many questions.
No,
I don't even that like you really like dazzled us. I'm like so dazzled with knowledge about what we've talked about. So it says, is there a criteria to measure the severity in each child? And what are the chances of a person living in a fairly normal life as they grow? I believe this is a concern for most ASD parents.
So I'll show you a picture. I think I can show you a picture on this. So I always tell parents that autism is not it's not a level. So, with assessments, you say this is level 1 or level 2, and so forth. It is not measured like that. And I would actually like to show you this before we move on.
Okay.
It's on my mobile. It was something I was just working on recently.
Okay.
So, and I think it's worth the time.
Everything you show us is worth the time. I'm telling you, the knowledge is amazing.
Oh God, just give me a second.
So for people listening, we're talking about autistic spectrum disorder. If you've got questions, please kindly send it to us in the chat, and then we'll try and see if Dr. Khan can address this. And obviously this is happening because Dr. Khan is a pediatric neurologist. He specializes in like children, especially neurological symptoms. And he's come to speak to us from Bujo Medical Center, which is one of the most prominent hospitals in the UAE. And I think like if we have any questions, and also if you've missed anything else, we're recording this and we should be able to share with you so that you can catch up and share with friends also. And we put it up on YouTube now, so that's good for extra knowledge. So I know I have a lot of questions to go through. We'll try and get through almost all the questions, but obviously it's also past 9 p.m. It's almost 10 o'clock in Dubai.
It is.
And our doctor has to go to work tomorrow. So we'll try and see how much we can do.
No, go on. I can't still find it. So the answer to that question, I can't find that image, but it's not a meter where you have this much or this much. It's not that. It's basically two kids and who have colors not lined up, but spread across. So one child might have a lot of emotional intelligence, but very little of normal intelligence, cognitive intelligence, whereas the other child might have very little of emotional intelligence and more of cognitive intelligence. One child might be very good verbally, but the other child might be very good socially. And so it's a mix of a number of things that makes up a child. And the job of the specialists working with the child is actually to go into that puzzle and unwind it to see what areas need strengthening and what areas do not need strengthening and just need maintenance. And that's the job of an entire team working with autism spectrum disorder kids.
Thank you. And the next question says, help me understand what causes the child to regress in their development, especially where the child has met most of the early milestones and there are no medical scans or checks to show a scientific change. I think that's a good question.
Very good question. Yes. So 35% of children who are on the autistic spectrum undergo regression. But they undergo regression in a specific age group. So between 12 months to maybe 18 months, maybe 20 months. They will have few words, they will lose those few words, and then they will plateau out. But if the regression happens later, like 3 years or 4 years or 5 years, there is either an underlying metabolic disorder or an underlying epileptic disorder that has to be managed by a neurologist and identified by a neurologist.
Okay, thank you so much. Someone else has said, thank you so much for this information. This is very informative. What would someone with a late diagnosis need, given as an adult after being misdiagnosed for years? So I guess the person's had different things going on, and then it's just happening now.
Even if the diagnosis is made late, it's better late than never. So the demand of that particular individual at that age would have to be addressed. So I know 19-year-olds being diagnosed with autism now, but they've gone through their college. They are struggling with their social life, for example, their relationship. And that's where you need a relationship counselor, a psychologist to work with these individuals who are high functioning usually, to explain to them what social interaction means, what is give and take, what are emotional quotients, how to understand other person's needs, and those kind of things. So they've gone beyond the age where they need to build their social skills from scratch when they were 3, 4, 5 years of age. So the requirement of a 19-year-old is completely different as compared to a younger one.
So the next question is just about tantrum, but we talked about that already, about tantrum being an anxiety or something that's triggered it, and it's not really a tantrum. It's just that the child's unable to express what they need. That's how I understood that, right?
Yeah, that's right.
I think we should go on to the next question. How well do educationists in special education needs able to work with doctors to help children?
They don't work with doctors, but they work alongside them in a different environment. So in Dubai, for example, or UAE, we have special educational need coordinators and teachers working with these children within the school environment. So they help teachers educate them. They help get the right help for the child and work with the academic curriculum that they're following for children on the spectrum. If they have a problem, if they have a problem with attention or the child's behavior, or the child had a movement disorder or some kind of an epileptic seizure, that's when they will knock on the door of a neurologist and say, okay, can you address this? But usually they work with their therapists. So whether it's a behavioral therapist or speech therapist, they interact with them for the best kind of program for the child.
Okay, thanks. So the next question is, thank you. Please, how do you manage constipation in ASD? I guess that's
like a regular constipation management, whether it is, you use Movicol or lactulose or Senna. There are many of those medications that can be tried depending upon the child's need, but it doesn't have a special treatment protocol. You would just use it. And the most important thing is to change the diet in children with autism, because usually they get fixated on a specific type of diet. And if that diet is poor or low fiber diet, that's when they will struggle with constipation. And that needs to be changed first.
so again, I guess that's the whole thing about going to the right place, making sure that you're seeing a neurologist who knows that the nutrition is important, who knows that speech needs to come in, occupational health needs to come in. There's a family education. You're carrying along everyone, because it's all about multidisciplinary team work, right? It's not just one doctor knows all that treats them. Like your team you've got a team of people, and this is what they do, and that's why you're able to help your patients, and they do really well.
And I tell my patients when they come to me, I say, don't expect all the answers from me, because I'm not an expert in everything. I'm like a traffic police. I can guide you where to go for your question or your child's need. But we have the resources under one roof to help you with that. So your child will be looked after by not one, but maybe 6 different specialists. And you have to have the patience and the compliance to get the best out of it.
I think that's the beautiful thing about modern medicine, isn't it? Is the multidisciplinary approach. It's not one Lord that does everything anymore.
Interdisciplinary. I mean, we have gone beyond being multidisciplinary. So multi
we call it multidisciplinary in the UK.
Yeah, I mean, in the UK, even when I was there about 9-10 years ago, we used to say multidisciplinary, but multi means you have all the specialties, but they might be kind of in different places without interacting with each other. What interdisciplinary means is each discipline interacts with each other.
I like
that's
that
what's
word.
required. Yeah,
I like that word, actually. It's almost like meeting of like minds, right?
Absolutely. Yeah.
So the next question is, do you find diagnosing ADHD with ASD difficult or easy? How do you proceed to differentiate between the two?
Very good question. And that's there's a high false positive diagnosis in this. A number of doctors diagnose ADHD in children with autism who do not have ADHD in the first place. And for this, you need a specialized center, and not just one doctor, but maybe a psychiatrist along with a neurologist, with a behavioral therapist, putting the child through the right assessment tool to say that on top of autism, this child has attention deficit disorder. And only then treatment can be initiated after that. So it's not that easy.
Okay. You've got a shout out from Dr. Nida. She's a pediatrician, autistic mom from Pakistan. She just says Dr. Nida. So that's a shout out.
Hi, Dr. Nida.
Okay, someone else has said, thanks for this presentation, so enlightening. And the next question is, hello, is ABA therapy beneficial for ASD?
Absolutely. Because when I was in the UK, ABA was not very popular. It was popular in the US because it originated from there. But in UK, we were not very accepting of that. When I came to UAE, I started working with ABA therapists, with board certified behavioral analysts, and I started learning more about it. And when I utilized that in an appropriate way with the right guidance and the right context with the child, we started seeing dramatic improvements. Okay. So I would recommend, no matter what behavioral therapy you start for your child, they need that foundation of behavioral input before you move on to more skill-based therapies like speech therapy and OT. So ABA does work, and I can vouch for it because I've probably had the privilege of working with close to 500 children in the last maybe 4 or 5 years, and it has shown significant beneficial effects.
The ABA therapy, what does it involve for people that just joined? So it's just to cast a bit of an eye on it.
So it's an analysis, basically, as the name suggests, applied behavioral analysis. So the behavior is analyzed in a way that the ABC thing, where you pick up what is the antecedent of the behavior to change the consequence of the behavior. And what these specialists do is they observe the child, understand the child at home and school, and then realize, okay, the particular behavior is being preceded by a certain antecedent. And then they change that antecedent. They give certain instructions to school parents and do one-to-one therapy with the child to retrain that behavior. It's about altering or modifying certain behavior which has developed over years, because you would need that practice and training to retrain them to adopt a new behavior. So that's what it is. And we as a society, we have certain rules and certain social skills are expected of each one of us. Many kids who are on the spectrum do not have that capacity to imbibe those skills by themselves, like us, we do. So what we try and do is instill those skills within them so that they can integrate into the society that we have made. But what neurodiversity actually means is that instead of changing them, now we should look to change us and the environment that we live in.
Exactly.
How to incorporate, integrate them into our environment, knowing that, yes, children on the spectrum would have certain deficits. If all of us understand that within a classroom, within a shopping mall, within a movie theater, on a plane when we're flying, if all of us understand that, the child doesn't have to adapt.
Exactly. That's interdisciplinary living now we're going to achieve, right? Makes sense.
Absolutely.
So this is some children who use phones excessively sometimes exhibit poor eye contact, poor communication and interaction, and selective mutism. With restriction of phone use, they seem to improve. Is there an explanation for this seemingly as an autistic mimic?
Yes. So screen time or phone use is one of my hot topics, and I've written a lot and spoken a lot on it.
About that, yeah.
So I called mobiles as electronic nannies, and I call them electronic nannies is because parents use them more than children to get time for themselves.
For themselves, yeah.
So I give a phone. Yeah, I give a phone to my
YouTube.
child. I get 10 minutes of my own time to do what I want to do. So they are electronic nannies, and so do screen time. Yeah, excessive screen time does lead to speech delay. It does lead to poor social skills. It does lead to significant sleep problems if by suppressing what is known as melatonin in our brain. So screen time has its own problems. We have no doubt about it. But when a child on the spectrum, parents completely stop screen for the child and say, okay, now I'm not showing him screen at all. I don't recommend that. I say to them, like, use screen as an activity where your child learns that between 4 in the evening to 5 in the evening, I am going to get a screen to entertain myself, whether it is a PSP or a Xbox or a mobile phone, doesn't matter. I get a screen in this time and I look forward to it as a reward and I use it. But it should not be used as a hand or your accessory of your body part, which is with you all the time. And this is not just for children on the spectrum, but also for young kids. What I feel really upset about is the fact that schools are moving towards a purely screen-based teaching. And I don't know why that's happening. And books are obsolete now. My kids, they go to school here. My child goes to North London Collegiate School in Dubai. They have a branch in Dubai. And he doesn't carry books with him. He just carries an iPad, or sometimes the iPad is at school. And I don't know that, why we are encouraging them to get away from books. Yes, there are books that are available on iPads and, your different
computer
iClouds and all that on computers.
Yeah.
But I don't want books to be obsolete. I don't want books to be, a fossil there lying in a museum 20 years down the line. My grandchild saying, okay, this is what a book looks like. It will happen, I'm sure. But I don't think we should propagate that a lot. And we should make sure that screen time is minimized, even at school. And screen should not be the only medium by which kids learn. And I'm trying to pass this message on within, the number of schools that are here in Dubai. But I'm probably fighting a losing battle. So
I think it's like you have a good point. Like as a child, I used to read so much. Now it's like everything's like on YouTube. It's like it's crazy.
Yeah.
The kids are like constantly like, for some reason they know how to put the password, they know how to do all the things, but they wouldn't sit down and read. It's sad, isn't it?
Absolutely. And especially it restricts the opportunities, social opportunities. So if I give a screen to a 18-month-old child and the child keeps looking at that screen all the time, and the screen doesn't demand you to reciprocate, it's one-way communication. So why will the child even attempt to reciprocate?
Or
And when the
speak.
child, yeah,
Mm.
and when the child, and what the child sees there is a very colorful world all the time, where there's a farm, there's a farmer, there's a pig, and there is a green this and that. It's all colorful. The moment the child comes out to a boring natural world, real world, that's where he goes into a cocoon and kind of goes into a shell, because he doesn't want that life. He's seen something different all his life. And that's why excessive screen time cannot cause autism, but it can worsen the symptoms or that the child already has.
We have 5 minutes left, yeah, and I'm going to try and just go through this last question. And I think, like, honestly, we can talk to you like the whole night, right? But you've got to still get some rest, and I guess we still need to do a recap because we need to do the presentation, if that's okay. So my child was seen by a clinical psychologist who, after using ADOS, thought the diagnosis was inconclusive and deferred the child for 1 year. However, raising concerns for ADHD, within 2 weeks, a pediatrician did a hallway diagnosis of ASD, which was followed up with observations. It is just so confusing for parents. It is, since there are no medical scans or checks, how does one rule out the subjectivity? On one hand, you want the child to get early care if they are truly on the spectrum. On the other hand, you do not want a child to carry a wrong label for life. That's a beautiful question,
Very
actually.
good question. And
Because that's a lot of people are thinking that it's not easy. Yeah.
It's not an easy answer. So what I didn't understand, did both the pediatrician and the psychologist do
I think we have
ADOS?
two different. So they said the psychologist said it was inconclusive, right?
Yeah.
And then the pediatrician did a hallway diagnosis.
Hallway, I don't understand.
Maybe just saw the child and said, oh, it's ASD. Exactly.
I will completely, no matter who this pediatrician is, I would, or a neurologist even, if they haven't kind of laid out a clear plan with assessment for a child and just made a diagnosis based on observation, I would completely neglect that. I would go by the psychologist assessment who carried out an ADOS and then concluded and proved that he's on the borderline or he's not conclusive. I would repeat that in 6 months' time. That's not a problem. But I would not label the child with autistic spectrum disorder on a non-confirmatory assessment result.
Makes sense. Thank you so much. Honestly, I think we can talk and talk and talk. There's one more question I'm going to take, and that's it, right?
Yeah.
So it says, my son is on the spectrum. He keeps hitting. He keeps hitting. I don't know what that means. Maybe hitting. How do I help him stop?
Hitting, you mean? It's self-harming.
Yeah. I guess so, yeah.
So in many children I don't know how old her child is. I'm assuming that he's 4 or 5. Kids self-harm or self-mutilate at times, like biting their nails off and biting their skin off, simply because as a regulatory mechanism to certain emotions that they have. And anxiety is the most common emotion. They're just anxious of being in a place. They're just anxious of people around them. They're just anxious of the sound around them. They're anxious of white walls that they're seeing. We might think this is very trivial, but for them, it is a big sensory overload. And if that does happen and they're anxious, they will then seek some kind of a self-harming behavior to get rid of that. So don't target the behavior itself. Don't pull their hand off and start, kind of giving them physical punishment if they do that. Rather, work on the anxieties that they have. So either desensitize them or go to a psychiatrist and see if anti-anxiety medications might help them.
Okay, thank you so much. Honestly, Arif, I'm going to say thank you, right? And okay, so as I said earlier on, like we're giving out like free virtual consultations. You just need to email info@animalhealth.com. That's it, and then we'll connect you to have appointments with Dr. Khan easily, and then obviously then take on and do proper treatment what you need, and then we can also share information if you've got questions. And I'm going to say a big thank you to you. And we still have another date of talking about comorbidities, because we couldn't obviously go through them properly today because there are too many questions. Like I'm just going to collect the questions and wait for next time. I think that's the best way forward, because we're not going to be able to exhaust everything today. And I also want to say a really big thank you to Bujal Medical Center. They're like our partners. They've been really great. They've actually supported us being able to educate more people, which is what people want, is to be able to speak to their doctors directly. I don't know. Like, I think this is really nice.
Well, thank you so much, Dr. Chichi, for that opportunity. And I think it was a great session, lovely questions. And I would like to thank the listeners and the audience here for the privilege of their time and throwing out those very relevant, very appropriate and kind of very questions that would help not just them but everybody else who are listening on this platform. So thank you.
Thank you so much. And thanks everyone that's come. As we always say, there's like, I think it's good afternoon from the US because there are people from the US and Canada. Obviously, good nights from from the
From
US.
Dubai.
And then for the UK, obviously, still good evening. It's actually really bright in London today because we've gone into
Wow.
summertime, right?
You're in summer, yes.
We're in summer, so it's like really bright in the UK. And obviously, good night again in Nigeria because a lot of people logged in from Nigeria and from other parts of Africa. We've got some people from Ghana also, which is really good. And I just want to say, like, honestly, we cannot thank you enough.
Thank you for that.
And hopefully we will share, like, when the videos are now ready on YouTube and people can catch up, and if they've missed anything, share with friends. And I think then we will take on the next session about, because I think a lot of people, this is a significantly important topic and everyone's like hanging on the fence, not sure what to do about it and where to get the right help from. And I think I'll take home messages. You've got to be treated by the right person who knows who has experience. And you've got 20 years experience. We can't substitute that for anything else, if that makes sense.
Yeah.
Thank you. And have a good night. Okay.
You
Good night,
too.
everyone. Thanks everyone for joining.
Bye, Chichi. Take
Bye.
care.
Bye. Thank you.